Hello everyone. In this section I'll discuss about now histology of female reproductive system, which includes the microscopic structure of uterus, ovary and uterine tube. Okay. So coming to this uterus, see here you can see the section of the uterus. This is the inner aspect, this is the outer. From inner to outer the layers are, this is the endometrium, then there is the myometrium, then outside that is the perimetrium. Okay. So endometrium, there is a mucosal lining, the cavity, that is the cavity to the wall. Okay, that is the inner layer, that is the mucosa, that is the endometrium. There will be lining epithelia, that is simple columnar, with uterine glands will be there. Okay, then with connective tissue, this is the lamina propria. Then coming to this myometrium, there is inner and outer longitudinal, middle circular, with this interstitial connective tissue will be there. Okay, interstitial, so the connective tissue also will be there. Okay, then this is the perimetrium, outermost layer, that is lined with connective tissue with single layer of squamous cells. These are the layers of the uterus. Okay, then here you can see this is the proliferative phase of this uterus. Okay, then so this in a 28 days of this menstrual cycle, first to 4 days, that is the menstrual phase, 5th to 14 days, that is the proliferative phase, then 15 to 28 days remaining, that is comes under the secretory phase. Okay, so this is the section of this proliferative phase of the uterus. During each phase there will be changes in the ovary and the uterus. Okay, so this is the endometrium, this is the myometrium, this is the endometrium. See the endometrium, this is the lining epithelia, that is the simple columnar. See, you can see these are the uterine glands, those are the uterine glands will be there. This is a connective tissue, you can see, that is the lamina propria. There you can see arterioles will be there, these are the coiled arterioles. Okay, see this is the 2/3, upper 2/3. See, this is the upper 2/3 of this endometrium, this part. Okay, that is called the stratum functionalis, or the functional layer of this functional layer of the endometrium. Okay, see the basal layer, see the basal layer of the endometrium, where they can see closely packed uterine glands with straight arterioles. Okay, that is called the stratum basalis, or this basal layer. These are the two layers of this endometrium. Okay, then comes the myometrium. See the myometrium, there will be the circular and longitudinal muscle fibers interdigitated with each other, inner and outer longitudinal middle circular fibers. Perimetrium is not there in this figure, that is lined with the simple squamous cells. Okay, so that about this proliferative phase. Here you can see this is the secretory phase. Okay, see this is the endometrium. Okay, endometrium. See it increases in thickness from the proliferative to the secretory phase. Okay, then here you can see a part of this myometrium. Okay, so what is happening in this menstrual phase, there will be the shedding of this slug of the stratum functionalis of the endometrium. Stratum basalis remains intact. Okay, after menstrual phase, okay, stratum basalis starts developing into this, transforming this stratum functional layer. Okay, then functional layer increase in thickness. Okay, the total endometrial thickness increases in the secretory phase. Okay, then menstrual phase, then it is going to this menstrual phase. That time there will be the shedding of this stratum functionalis. Okay, see the here you can see this is the uterine glands. See the uterine glands, it's a sawtoothed appearance. Okay, filled with the glycogen will be there inside. There will be the glycogen. You can see there is the coiled arterioles, you can see. Okay, then this is the lamina propria. Okay, this is the myometrium, inner outer longitudinal middle circular, then outermost layer, that is the serosa. So that's about the structure of the uterus of the proliferative phase and the secretory phase. Then here you can see this is the ovary. Okay, see the shape itself is like. Then this is the cortex. Outer part is the cortex. inner part, this is the medulla, where you can see this is the blood vessels, nerves, everything that is in the medulla. Okay. So the cortex consists of numerous ovarian follicles at various stages of development, that is from the primordial follicles to primary, secondary, then mature graphene follicle, then corpus luteum, then this is the corpus albicans. Okay. Cortex consists of ovarian follicles at various stages of development. See here, you can see these are the primordial follicles, small. You can see the oocyte in each follicles. Okay. Primary follicles that is lined with the squamous cells. Okay. So at birth there will be numerous lanes of primordial follicles will be there. After puberty, the primordial follicles starts maturing into primary, secondary, graphene follicles. Then release of this ovum, then there will changes to that graphene follicle to corpus luteum, that degenerates to forms is the corpus albicans. Okay. Here you can see then this is the primordial follicles. Here you can see this is the primary follicles. Okay, that is the columnar cells changes to form the squamous cells changes to forms the columnar cells. Okay, then it divides to forms the granulosa cells. Okay, that is the granulosa cells, small spherical cells, granulosa cells. Then there is the formation of a follicular cavity will be there. Then it is called the secondary follicle. You can see a cavity there, follicular cavity. This is the mature graphene follicle. This is the mature follicle. Okay. Then it releases rupture of this follicle, release of ovum into the pelvic cavity. Then that one changes to a corpus luteum. It appears as yellow in color. Okay, that one secretes mainly the progesterone. Okay, progesterone, estrogen also secretes. Then it degenerates, forms the corpus albicans. See, this is the corpus albicans. Okay. Here you can see in this section, you can see the cortex of this ovary with numerous primary follicles. See, this is the outer lining epithelia. It's made up of cuboidal cells. That is called the germinal epithelium. Here you can see these are the primary follicles. You can see this the oocyte there. Outside a single layer of cells. Then it changes to multi-layer. Then it is called the primary follicles. These are the granulosa cells. Okay. See here. That is again the section of this cortex. You can see this is the cortex, germinal epithelia. See numerous primordial follicles, primary follicles. See, this is a secondary follicle. You can see there is a follicular cavity. This is the antrum. See, these are the granulosa cells. This oocyte which is in eccentric position. See, outside of this granulosa cells, there will be a theca layer, theca interna, and there will be the outermost theca externa. Theca interna is made up of spindle-shaped cells. Theca externa is made up of some smooth muscles and connective tissues. Okay, so the theca interna which secretes the estrogens. Okay, so this is the structure of a mature follicle, that is the graphene follicle. Okay, see the oocyte, it's in the eccentric position. That's about the structure of this ovary. Then here you can see this is the fallopian tube or the uterine tube. Okay, it's a tube-like structure, it's circular in section. Okay, see the mucosa, it shows numerous folds. You can see the folded appearance of this mucosa, folded appearance with irregular lumen. Lumen you can see, that is irregular lumen. This is the muscle layer. This muscle layer that it's consists of, there is the inner circular. This is the inner circular and this is the outer longitudinal. Okay, that is the muscle layer. Okay, then outermost layer, this is the serosa. Outermost layer, it's lined with the connective tissue with the squamous cells. Okay, so this is the structure of the fallopian tube. Okay, see the mucosa, inner to outer mucosa, muscle called serosa. Okay, in this figure you can see the enlarged view of this mucosa. See this is a folded appearance. This is the lumen, this part is lumen. So it's lined with a single layer of columnar cells, that is the ciliated columnar cells. Okay, ciliated columnar cells. Okay, in between the ciliated columnar cells, some cells won't have cilia. Those are called the secretory cells or PEG cells. So lining epithelium of the uterine tube is ciliated columnar with ciliated cells also there, and non-ciliated cells which are secretory. Those are called the PEG cells. So that about the mucosa of this uterine tube. Then coming to the clinical features. Okay. Here there can see there is ovarian cyst. Okay, usually this ovarian cyst means that is a collection of fluid filled cavities. Okay, those are called cyst. If it is more than 2 centimeters, then it is termed as an ovarian cyst. Most of them are functional cysts that disappears in the next cycle. Okay. Then in some cases, okay, there will be the cyst. Okay, usually the functional cyst which disappears in the next cycles. There will be endometrial cyst or chocolate cyst will be there. This we already discussed this endometriosis. Okay, if it is present on this ovary, then it also secretes bleeds. Okay, during menstruation, that ovarian, this chocolate cyst also bleeds. Okay, that's why it is called a chocolate cyst. This endometrial cyst is also called this chocolate cyst. Then other condition is the polycystic ovarian syndrome, PCOS. Okay, usually this one follicles attains the full maturity. Okay, there will be the formation of this graphene follicle will be there. Okay, what is happening in this PCOS is there are numerous immature follicles will be there. Okay, it won't attain that maturity. Okay, this is usually happening in this obese females. Okay, it is one of the causes of this infertility, this PCOS. Then dermoid cyst, if the cyst contains this teeth, hair or fat, then it's called this dermoid cyst. It is benign. Then you can see this blocked fallopian tubes. If there is any inflammations there, okay, pelvic inflammatory diseases or this endometriosis can cause scar tissue and adhesions, okay, which blocks this fallopian tube. That is also one of the causes of this infertility. Then say this ectopic pregnancy. Okay, the fertilization is happening in the ampulla of this fallopian tube. Then it moves towards the uterine cavity and gets implanted in the posterior wall of the body of this body of the uterus. Okay, so if the implantation, if the embryo starts growing in the fallopian tube, then it is called the ectopic pregnancy and gets ruptured. Okay, it requires immediate medical care because it produces abnormal bleeding. Then here you can see this is the hysterosalpingography. So see, this is the X-ray image of this hysterosalpingography. So it's a radiological procedure. Okay, this hysterosalpingography, it's a radiological procedure to investigate, to see this shape of this uterine cavity, the patency of this fallopian tubes. Okay, during this procedure there will the radiologist, okay, inject a contrast or dye to the vagina. Okay, the dye goes. Okay, if there is any block is there, the dye won't go beyond that part. Okay, to visualize if there any blockage in the fallopian tube or any other structural abnormalities in the uterus. That procedure that is called the hysterosalpingography. That's all about this histology and clinical features of this female reproductive system. So hope you understood. You should write answers for this in your assignment book. That is the microscopic structure of the uterine tube. Okay, its lining epithelia is ciliated columnar. Okay, that is the mucosa. Then the muscle cord, circular outer longitudinal. Then outermost layer, that is serosa. What is ectopic pregnancy and is hysterosalpingography. Okay, thank you.